Alrighty, and we are live. Happy Monday, everyone. This is a little bit unusual from our times, but regardless, thank you so much, everyone, for joining us today. I'm Natalie, and I'm here with Dr. Miriam Bakhtiari, the inventor of BLAFit. And today we're going to talk about how you can start incorporating this into your everyday routine so you can have a nice solid routine every day to take care of your facial muscles and just help bring out the best version of yourself. So
Absolutely.
yes.
This is our time.
It feels a little different, right?
On a Monday when we're off. So good morning, everybody. We're gonna wait a little bit more for more people to hopefully join us. It's an odd time, 10 or 9 o'clock on Mondays.
Yes.
But hopefully this is actually gonna be a better time. Yes, you want us to talk about BLA, what it is for those of them,
Yes,
people that are
absolutely.
watching this video, either rerunning it or live. Is Bella Lip Appliance is an appliance that I created a few years ago in order to work out your facial muscles and create increased circulation, increased muscle mass in your facial structure, just like what we do with our body at the gym. And I came about this in my practice here. I've been practicing orthodontics, TMJ and sleep apnea for close to 30 years, and create beautiful broad smiles, create alignment of the jaw, trying my best to get skeletal problems that are surgical to at least push them toward less invasive surgical or avoid surgery if it's possible. But I realized that as we are bringing out beautiful smiles for patients, and I'm using these orthopedic retainers to create that smile, the facial muscles are not being activated. Meaning, I start looking at faces and I realize that 15-year-olds, 16-year-olds that come sit on my chair for their braces, they are actually having facial muscles that are more saggy, more flat, lips that are a little bit downward. And it questioned me a few years ago because I said, what's going on?
I'm sorry, the question that they just submitted right now, they asked if it plumps other lips too.
It's for your upper lips
Your
and lower
facial
lips,
yes.
facial muscle. It anchors around your lips and it exercises your facial muscles. So I realized that more younger kids need face enhancement things in order to look more fresh. Old days, if you look at 1940s and 50s and 60s, the movie stars, the facial muscles had so much anatomy. Today, when you look at most of us, unless we're injecting facial fillers and sculpting our faces, we're actually very flat. We don't have that cheekbones that are more prominent, and our lips, unless it's injected, are sagging faster. So I knew that if I could, because I feel like I know the facial muscles more than a lot of people in my industry, due to doing the orthopedic retainers and treating TMJ patients. And I thought if I get in and create a device that anchors around the lips on both ways and has a specific resistance that could plump up the facial muscles from the under eyes to the neck, yet does not create TMJ, it was the challenge. What resistance can we use and how much do we need to move it up and down, how the gadget should be formed so that we don't create or increase tension in our jaw joint. As a TMJ diplomat, I knew that we can never track the lower jaw back, and that's because of very, very important anatomy, which is the lower jaw. Right behind it, we've got the major blood supplying nerve and artery that passes and feeds the side of our skull. If the lower jaw is tracked back with things that goes in our mouth, we can actually create more increased tension in the jaw, headaches. So I knew that being in that space, I needed to create something that would not increase the tension. And how can I make something that works out the facial muscles, opens and closes the same amount of your maximum range of motion of a normal patient, And at the same time, how can we do this so that we're actually treating the TMJ at the same time that we're plumping our facial muscle? It's a lot more complex than you think. There's a lot of products out there that it scares me. I get goosebumps when I look at them because they're big. And if I put a big gumball, one of those, what do they call them? Jawbreakers in my mouth. Why is it called jawbreaker? Because your jaw joint can displace from that heavy duty, hard, big ball mass. So we can't put these big things in our mouth and clench. If we start exercising our facial muscles by clenching the muscles, of course, we will have more, our face grows this way and we will have more square faces, but it's not attractive in my opinion. It looks like a clenching face. And the other negativity about that is if I put anything in my mouth and I clench on it, I'm actually increasing the TMJ issues and decreasing circulation to the brain. So what happens, again, as a doctor that does this all her life, when you put something big in the mouth, it shifts the lower jaw back. The jaw goes open and it goes back. And we don't want to increase the cut of decrease the circulation to the brain. We want to open that pathway. So it always scares me when people that are not in medical field do things that they have no idea. One of the most important regions in our body, and I work with a medical doctor and an aircraft engineer, and I will tell you, we work in this practice with ENTs, you know that, neurologists. The jaw, right behind the lower jaw, where I showed you, is a very big neurovascular region. So heart is very important, brain is very important, but guess what this is? This is a path to connect these two organs. If we clench and we push this jaw back and now we're decreasing circulation to the brain, we're creating brain changes, we're creating brain neurologic disorders, we're creating patients to have more migraines, more headaches, lockjaw. So it's very important that anything that goes in our mouth, whether it's a big piece of meat that locks our jaw or these things that people are coming out in the market and they're selling hundreds of them to poor kids, is to know that anybody give you anything, they need to train you. They need to be trained on the TMJ. They need to know the facial muscle and how vascular this area is so that you don't decrease and you don't create neurologic issues. So when I created the BLAFit appliance a couple of years ago, we were giving an instruction booklet, but we were always available as a support for patients that had problems. I remember one of the people that bought from Amazon a BLAFit appliance, and she wrote a comment in the sense that, it caused her jaw pain or something like that. It brought to my attention that if it's not used correctly, I don't know what they're doing in their home with the BLAFit appliance, and I'm sure the instructions in ways is not sufficient for you to be able to protect your jaw. Even though we made video instructions and put it in our website, we realized that it's necessary that we train you for at least 5 minutes, whether it's one-to-one or in a group training, so that you know how to use this tool correctly. If you learn and are trained to use this correctly, it not only works out your facial muscles and neck muscles, creates beautiful jaw lines, lifts your muscles of your lips from inside out, but also will make your cheeks more prominent, but also will help you more relaxation. It makes you more relaxed. It opens up the circulation to the jaw, and it actually treats TMJ. Now, I'm going to say that because I'm an expert in TMJ. I can train you, and I give this to my patient in my office, how to use this correctly to help treat it, treat TMJ, but we don't have any, we're still in the process of getting enough clinical data to publish, but that's what it is. So I don't know, I take myself, I get excited and I take out of range, but it is not a medical device, but I can say it is a medical device because I'm going to train you, and we sell it only in this practice. It's not sold anywhere else and on Amazon. And you either have to buy it from our website, which the packages are sent from here, or you can go ahead and order from Amazon. And all this product, every part of it is made in USA. It's packaged in USA, and we're sending it to you with a personal note either from me or Natalie.
Yes, absolutely. So my question was, someone had said that can't you just chew gum daily as opposed to using BLA?
Yeah. Again, when you put things in between your hard tissue, which is your teeth, you're actually activating your clenching muscle. So we have this, I'm gonna have you turn. So the clenching muscle, it's called masseter. It comes from your upper jaw and it wraps around the corner of your lower jaw. When you have food in your mouth and you're chewing, you're actually clenching the muscle. Clenching muscle will bulk masseter. I don't think bulking masseter is what we all want. Unless you have a very skinny face, most of the patients that are contacting me, they come because they're heavy clenchers already, and they already have a whole square faces, and their masseters are already really out of proportion, and they're like, is this going to help this to reduce it? And I would say with BLAFit appliance, because we're doing it in a calculated way and we're using no hard tissue, there's no teeth touching. We're only using our lips in an open position to do these exercises, and we'll train you to do that. You're actually stretching your clenching muscle. So for those of you that clench, which is 90% of us out there, it actually improves that clenching feeling. It just declenches you. But it also lifts those muscles that we don't use. So when you have the masseters, we have other muscles that are underneath the masseter. We're activating a different muscle than the clenching muscle. The only thing that will do to the clenching muscle, it stretches it so that your jawline is much more defined. It also tightens your, what we call digastric muscles, which is your tongue muscles underneath your neck. For those of you that have jowls, this is one of the best things, in my opinion, that will tighten your jowls if you do it, because the band, are you going to do it or should I do it? What do you think?
Let's let the expert do it.
We'll let the expert do it. So this is a BLAFit appliance. By the way, it's a durable device. It lasts you a couple of years. It's all made in USA, and everything is FDA approved colors and FDA approved special nylon that you can use this for 500,000 times and it won't crack or break. So it is a device that we're very proud to give to public, because we're giving something that's going to last you a few years. At the same time, we're giving you the training and unlimited help from our side. So you're getting a lot for this, and look what it will do. Remember what we talked about, the jaw? So when we're doing the BLAFit appliance, the appliance goes in the mouth and we're opening and closing or doing it this way. We're always going to remember this neurovasculature, and we're always going to move our lower jaw forward to open this roadmap, to create more relaxation, adding the breath to our work to get this done. So I'm going to do one, and Natalie's going to fill you guys in. So it's only the lips, soft tissue. We're not putting our teeth together. Our mouth is open. It's only lips. So it's very different mechanism. So please, I get insulted when people compare this with other products out there. There's nothing like this exists. You can duplicate this in China and bring it out. It's not going to do the same thing as this, because the resistance that we have here, we've done so many trial and error to be able to put that perfect resistance so that when you open and close, it will activate your muscles and not create TMJ. So here it is.
Also, always make sure to grab onto your BLA with onto the resistance band. So use your thumb and your forefinger. Don't hold on to the arms, but the resistance band. As she's closing, using both her upper and lower lip to bring the handles together, she's shifting that lower jaw forward and taking a deep breath in from her nose. And slowly she begins to open back up and releases her breath through her mouth. And if you notice, if you pay close attention, when you shift that lower jaw forward, not only are you allowing blood and oxygen to successfully flow into your brain, but you're also engaging your neck muscles, helping the jawline and your jowls. All the movements are slow and controlled. Your jaw is very delicate, so don't go very aggressive with this. Don't do it super fast and sloppy. It's all about slow and controlled movements.
You have to try it to believe it. So
you really do. Like when you try it, you'll feel it. Like it feels really good.
So that was one of the exercises that lifts your lips and it lifts the cheekbones, tightens your jowls, at the same time open up TMJ area where people that have migraine and headache, it would release that. And relaxation, and your clenching muscle feels like stretched. So it's really great feeling. You only need to do 5 times, maybe once in the morning, once at night if you want to have a good sleep. It tightens your digastric, which will slow down on your snoring. If you're a loud snorer, it will slowly get improved. I'm not going to say it's a anti-snore device, but we've had people that used it told us that their snoring has become reduced. They feel more refreshed in the morning, but we know because it puts your system in a very parasympathetic nervous system. So I had already a big morning today.
Yes, you
and
did.
I came and Natalie met me 20 minutes ago and she says, "Oh, you look tired." And I said, "I had a rough day already." So I had like a big day already with things with my kids. So this 4 just puts me in a place that I feel like, okay, life is good. Everything is good. It really puts when you get that breath in and open that blood supply to the brain, you're actually telling your brain everything is good. Everything is cool. Is that low battery?
Yeah.
Oh my goodness. So that was the vertical exercise, which is to me one of the most important exercises for me. That helps me so much. Now there's a second exercise there's much more exercises than just these 2, but these are what we want to teach people first. We will get to advanced moves privately, but we are going to do the horizontal exercise, which lifts the lips, feels this area, and lifts the cheekbones. So this is nothing to do with your jaw. It's your mouth in an ah position, and we're only using the corner of our lips, not the top and the bottom lips in this exercise, to bring the arms together. It's kind of like a thigh master on your mouth.
Again, make sure you hold on to the resistance band with your forefinger and your thumb. And when you do this movement, you don't have to bring in the handles all the way. She's only bringing in the handles about like halfway, and she's maintaining an O shape with her mouth. The same shape that your mouth creates when you say ah, maintain that in that same exact shape throughout the whole movement. Take deep breaths in, so take a deep breath in when you close from your nose, and then slowly exhale through your mouth as you open back up.
Okay, so I got my facial workout done. So today is about what is a routine. Well, I don't know what everybody does. I'll share with you what I do for my face at night and in the morning. So at night when I go to my bathroom, I wash my face from all the toxins with a very mild soap. And then I apply my serum. I like to put vitamin C serum, hyaluronic acid serum. I have some that I mixed up and I apply on my clean skin. Oh, I forgot. First, when I wash my face, I spray in some rose water. Mm-hmm. What we've learned with rose water, you can buy from Whole Food Market the one that are in a spray bottle, or if you have a sprayer that is at home that works for your cosmetic stuff and is clean, just go to any store that is Middle Eastern and they have rose water in there, or you can order on Amazon. Get your rose water and just put it in a spray container and keep it in the refrigerator in a cool place. So now you wash your face You spray the rose water, it closes all your pores, and it feels so refreshing. Then I put my serum all over my neck, my face, and then I do my bellow lip appliance exercises. This is routines before I go to sleep, and I do this by my bedside so that I can get myself into a very relaxed mode to go to sleep. In the morning when I wake up, sometimes I don't do it in the house, but I do the same thing at home, but before I come out of the house, when I'm doing my things, putting my clothes, it's in my mouth actually, I'm doing few exercises. But majority of the time during the week when I'm here, I do it at my desk. I have one in my desk here. And between Natalie and I, we do at least a lot of repetition during the week because we're training people constantly. But this exercise, you're pumping your own 50 muscles that are on top of each other, little muscles. Imagine little bands, and you're pumping it. So you're creating more volume in your muscle, and it's lifting your skin from the muscle up. So it's not something that is just to the outer layer and we're injecting you with something that's going to be absorbed. We're actually lifting the muscle out. So when you do that, you're creating blood supply increase in your facial muscles, you're increasing circulation, increasing your own collagen formation on your own skin. So it is a very good anti-aging process. We're going to meet a company that does face yoga, facial workout, so you go in there and you lay down and they do the massage from outer skin. This is a different thing. We can work in collaboration with all of them because we're actually working out using our lips to engage all the muscles that are attached to the lips to be able to get them work out. And we're just doing facelift from inside out. Now, if you're 17 or 20, this is an anti-aging time to do prevention. For me, I'm 54, and this is like something that keeps me maintained. But for Natalie and for kids that are that age, it is really good change of mindset that your face is no different than your body. We're so focused on our glute muscles.
Our gluteus maximus,
Yeah, everybody's wants their glute muscles to be bigger, and we're doing all this lifting and everything to get that, but we're all getting injections in our face because it is, I don't know why, it's just our society thinks that face doesn't have muscles, but we have more muscle in our face than the rest of our body, and they're smaller and they require few repetition to be able to get them lifted, so it doesn't require a lot of that.
Yeah, I mean, I think it's just so easy for people to just go and get injections. They want like immediate results, like they want, I think there's this, social media and everything is all about instant gratification, and I think that's why people often resort to injections because they want things fast. And working out is not about reaching a certain goal. It's a lifestyle, I would say. It's about taking care of your body. It's about something over long term, and people don't want that.
If you brush your teeth every night and floss and you wash your face and you shower regularly, you want to have a BLA. For those
that should be everyone.
Yes, for those that have a regular routine, and there's those people that they don't care about themselves and they don't eat healthy and they don't shower once a week and they don't brush their teeth every night or they don't floss. For those people, BLA is not a thing that they want to buy. You can buy it, but you're not going to use it. The reason we meet with you on Zoom is to show you the importance of this product, what this can do to you. It's just not facial beauty. And we want you to be able to take advantage of all of its benefits.
Mm-hmm. Yes. So as a reminder, when you make a purchase with BLA, please take advantage of the 5-minute complimentary. It's always more than 5 minutes. It's like 10-15 minutes complimentary Zoom training with me, Dr. Miriam, or a trained staff member to show you how you can use BLA correctly so you can reach your goals, whether if it's for TMJ, headaches, jaw pain,
or just
facial beauty. Like, we are here to support any of those goals. So take advantage of that. We love meeting and connecting with you guys and like learning more about our customers. So yes, definitely. And then I think it's such a great value too, because oftentimes there's been times where I've gotten a product and I'm like, I have no idea how to use this. Like, you have to look up on YouTube like videos on how to like use that. So it's just better to be able to have your questions, your specific questions, directly answered from us.
This is a very valuable bonus you guys are getting. For $85, you're getting a durable device that lasts you a few years. It's going to change the way you sleep, change the way you look, but you're getting also a consultation with us. So that consultation alone is worth a lot more than $85. So when we have patients here that invest a couple of $1,000s in their orthodontic needs, we do the consultations for BLA in the past as no charge. But now we're putting that for you. So we don't know how long more we can catch up with one-to-one, but for now we have still some lunch hours available. Please email us once you have it so that we can teach you. Don't use it until you learn how to do it correctly.
Yes. Hi Wendy. Wendy just asked, can you show how to use it? So Dr. Miriam did show us how to use it, but we would love to go over again so you can understand how BLA works.
I'll do it again just because I'm older than you and I need more exercise always. So Wendy, one thing that I don't know if you were here at the beginning of the talk, I want you to remember this always. Our facial structure is very vascular. It has a lot of blood supply. This picture only shows a bit of it. But if you look at your lower jaw, right behind the lower jaw is your major blood supply and nerve and artery that feeds the side of your head and your skull. Most of the exercises does not tell you that not push your jaw back. We never want the jaw to be pushed back. In my practice for TMJ, everything is outward so that we can release the jaw, we can release the headache, we can release the TMJ pain. So all of our movement is emphasized on shifting this jaw a bit forward. By doing that, you not only engage your airway muscle and tighten your jowls, but also release your TMJ, release that headache that you've had, that tension that you've had. And by opening that roadmap, you're tapping into what we call parasympathetic nervous system, which is the rest and digest nervous system. So here it is.
Also, you only have to shift the jaw forward when you do the vertical exercise.
So which side is my better side?
I think both sides look good.
I showed this side before, so let me show this side. So everything, all the anchorage is on the lip muscle. We have plenty of the videos in our Instagram and our Amazon, but it's all on the lip muscle.
So always make sure you grab onto your BLA from the resistance band with your forefinger and your thumb. Use both your upper and lower lip to bring the handles together and simultaneously shift that lower jaw forward. This is going to engage all of your neck muscles, help define your jawline, especially if you're looking into this for like sagging jowls. This is a really great movement for that. And as she's doing this, she is taking a deep breath in from her nose as she's closing. You're gonna hold that breath in, and then as you open back up, you're going to exhale. You can release the breath from your nose or from your mouth. We prefer our mouth. So this, what Dr. Rins is showing right now, is there's all of this engagements up, down from the jawline, all the way to the neck. Every muscle is being engaged in this movement.
So that was the lip, the cheekbones, and the jawline exercise. At the same time, it relaxes you, opens up the circulation to your brain. Your brain feels like, okay, everything is looking good, everything is beautiful. You really puts your whole central nervous system, which is your brain, in a very calm state. So you're working out at the same time you're getting the benefit of calmness and stretching your clenching muscles from all these rush that we do in our life. So now the horizontal exercise is to lift the corner of the lip so that your lips are not downward, and kind of lifts the cheekbones.
So with this one, you are inserting the handles onto the corner of your mouth, and you're gonna create an ah shape with your mouth. And maintain that O shape throughout the entire movement. So only bring the handles in about like halfway, and then slowly open back up. You can incorporate breath work into this exercise as well, like Dr. Miriam is doing right now. So she's taking in a deep breath in from her nose as she closes, and as she slowly opens back up, she's exhaling. So you'll notice with this exercise too, you'll really feel this in your cheek muscles. Like you feel, it almost feels like I can like imagine the cheekbones that are connected to like my mouth, and how it just like, you just feel that plump.
These exercises are made with the arms the way they are, so that we measured how much a normal jaw can open and what's safe for them to be able to open and stretch. So we use the belly lip appliance for patients that come here with locked jaw or short range of motion. They can't open and go side to side. We also use this as a physical therapy modality. It's going to grow to be in most physical therapist offices one day, because it is one of the best TMJ physical therapy tools that's going to be out there. We are little by little growing, but this is my passion, this is my life. I believe in this product, and that's why we're here to train you.
Interesting. I'm learning a lot. Thank you. Thank you, Wendy. Thank you so much for joining us and your lovely question. As always, if you have any additional questions, or if you want to learn more, you can always email us at order@blafit.com, or you can follow us on Instagram, which is just BLAFit. You're also welcome to send us a DM there as well, or just message us directly here on Amazon. We're always so happy to answer any questions. We understand that $85 may seem like a lot to some people, and we just want you to understand that it's definitely a worthwhile investment.
It's an investment. It's something that you're going to have. It's not a lipstick that finishes. It's a tool that you will have. It's kind of like your Peloton that you have. It's a tool that you will have for a few years, and it's backed up by doctors, and we're here to train you. So if you did buy it anytime soon, we will have still one-to-one. We still have few one-to-one sessions to give you, but soon it's going to have to be group sessions, because we couldn't afford our time and lunch hour to give to too many people.
Right.
But for now, it's still one-to-one, so take advantage of that.
Yes.
We love to teach you. This is our passion. This is not a gimmick that you buy and you throw in your drawer. This is going to change the way you think about your face.
So we'll be here next week on Monday. Let us know what you guys want us to talk more about.
Yes.
So thank you so much, everyone, for joining us, and have a wonderful week. One temporary filter is $500. This is not a lot. Yeah,
I know. We agree. Thank you so much.
Yes, Wendy, you're right. It is very expensive. Filler is expensive.
Fillers are expensive, but really, do I have time to say something about the fillers?
Go for it.
Just a really quick thing. I was listening to a podcast of a plastic surgeon that was saying that when you get the fillers, this is something I always knew, because my husband is also a physician. When you get fillers, the fillers are in the outer layer of the skin. It expands your skin. So they used to tell us that it absorbs by our body after 6 to 8 months, but now he was saying that MRI is showing that the fillers are not being absorbed. They're just being displaced.
Yes.
So remember that, number one. Number two, and this is what, after 15 years of having fillers in the market, now we're being told that it doesn't absorb. I mean, where is the filler companies to come and back and answer the consumers that now their lips are this big because it's not being absorbed? The second thing that it does is, if you have a burn, if you've seen people with burn victims that they want to do plastic surgery, the plastic surgeon balloons the skin so that they can stretch it and cut the back portion and suture it so it doesn't look like it's a big scar. So with the, can you open the door? I'm sorry. So with the fillers, we're actually expanding the skin, and by expanding the skin, where the next time that you're getting injections, the skin has more skin. Your lips have more skin that is stretched. So we had a few years ago, in fact maybe during the COVID in 2020, a patient of mine who is in her early 80s, and she's been injected since she was in her 70s. Her face doesn't look like an 80-year-old, but she was biting her lips. So we didn't know where her biting is coming from. She thought that maybe she has some issue with her bite, that she's lip biting. But then I was looking and I thought, why is there inside her lip is so much skin that's stretched? And I asked her, did you get lip injections for your, before? And she says, yeah, I was getting lip injections and now I stopped for a few years. And so what happens is now her skin is stretched. So now we have extra skin. So if you're 18, you're doing this, I would think second time. We don't want to stretch the skin so that you have extra skin that's going to be flabby when you're 50. Mm-hmm. What we need to think about, how to tighten and engage the muscles so that you don't need injections or lift it naturally. There's other, if you're into plastic surgery, I'm sure there's treatments that are better than injections. But injections, other than trauma that it causes to your skin, you just think about it. If you give a lot of stuff underneath my skin, when it absorbs, I have extra skin. We're stretching the skin. And if they're saying that it's not being absorbed and is displacing, that's why we're looking less and less like ourselves as we keep doing this. So I don't know what to say. If I was maybe 85, maybe I think about doing some of that stuff, but I wouldn't do it at age of 30, 40, even early 50s. I wouldn't get just Botox and injections. I will try to do everything natural before I depend on that industry.
Yeah, I like that viewpoint, definitely. It's all about embracing your natural beauty too.
Yeah.
It's about like taking care of yourself, and BLA is more than just physical beauty. It's about like taking care of your mental health, your physical health. It's all about that. So
yes, during the COVID, there was a lot of teen suicide in Torrance, and I was told if I could give these BLAs to kids that are in those centers, I will be able to teach them how to open up their blood supply circulation so that they are more calm, and maybe they could create less of brain stress for them. But unfortunately they told me because of the COVID I couldn't. But I will tell you, using the Bella Lip Appliance, for sure it's going to increase your mental awareness, because it's very simple. We're moving the jaw forward, opening the circulation to the side of your head. So it's going to be definitely good for your brain. It's definitely going to be good for your skin, and it's just a workout, and it only takes a minute of your day.
Yeah, everyone has a minute. Everyone has a minute. You see us scrolling all the time on social media, so everyone has 1 minute out of their day to just prioritize themselves.
Yes.
Simon said, hi Simon. Simon said, I agree. Everything's natural is the best approach.
Thank you so much, Simon, for always being there with us.
And Simon said that they've never had surgery in their life. They avoid prescription drugs. Yes.
Yes, please. I agree with you.
Okay, we'll catch you guys here next week. Thank you so much, everyone. We're going to move on to Dr. Haas's supplements, about how you can use a natural form of supplements for those of you that are experiencing menopause symptoms.
Yes, that was me.
That was Dr. Mary. Thank you, everyone.
Take care.
Bye.
Bye-bye. See you next week.